for the organizing committee to invite me and this opportunity to present today to you. And I'm actually really happy to meet all of you and actually to attend the meeting today and get to know what the charity is doing and who you all are, even though it's digitally, but it's really nice to hear all the stories. And I will be trying to give you a little bit of insight of research and the world of research in which you also can make a difference. Of course, Professor Deprez just presented also on very important research, and the type of research I will be presenting on is where we're actually going to try to include your perspectives and your needs and preferences. So as Babli said, I'm N Crombag. Indeed, I'm trained as a midwife and now working as a postdoctoral researcher for the KU Leuven in Belgium. So first, I would like to start with explaining why it is important, why your perspective and why the perspective of the parents or the patients is important in healthcare. But I think before I come to that, it's maybe important to see a little bit the transition of healthcare over the years. So back in the days, long time ago, it was more about caring and compassion, and clinicians didn't have a lot of other treatments available than that. And then over times, the advances in medical science have provided new options and mostly improving the outcomes. But another thing that happened was in healthcare that the focus shifted very much onto the disease. And it actually left out the patients and families in the discussions, in the important discussions around treatment. So for that, in 1988, the PICAR Commonwealth Program for Patient-Centered Care came with the term of patient-centeredness. And as you can see here on the slide, patient-centered care is defined as care that is respectful of and responsive to individual patient preferences, needs and values, and that ensures that patient values guide all clinical decisions. And it indicated actually that healthcare needed to shift a little bit from only focused on disease, also back to the patient and the family focus. So that meant that by approaching a patient, clinicians also needed to understand how that this disease was perceived by patients and what their needs are. And nowadays, alongside effectiveness and patient safety, patient experience is now among one of the pillars of quality of care. But what is patient-centeredness exactly? So the parents in 1988 had executed research together with families and patients, and they ultimately identified 8 characteristics of care that are most important indicators of quality and safety from the perspective of the patients. And these 8 dimensions, you see them here. They are firstly the respect for the patient values, preferences and needs, but also coordinated and integrated care. Another important thing is the education for the patient and the family with high quality information, physical comfort, emotional support, and of course involvement of family members and friends as appropriate. And then continuity of care, including through the care site transitions, and access needed to be organized. Well, what does this mean then, this patient-centeredness for day-to-day care? Well, for some decisions in medical care, there's clearly one superior path. For example, if you have a fractured hip, needs repair, or acute appendicitis, needs surgery, for example. But for most medical decisions, however, there's more than one reasonable pathway. And the different paths also entail different combinations of possible therapeutic effects and side effects. So in medical decision-making, it is on one hand very important to provide patients and parents with the latest evidence, but also an understanding of the patient perception is essential. And only this enables the care and decision support that it is provided based on the patient's needs, perspectives and preferences. Only in that way, healthcare services can expand, covering all aspects of care important to parents and patients. And patient-centeredness is not only important to patients themselves, because of course, I mean, if it meets your needs, you generally like it, but also because it is proven that it has a positive influence on the use of healthcare, on the patient outcomes, and also on the costs. So how? Normally you would expect that healthcare maybe is provided already in this way, and that it is respectful and responsive to individual patients' needs, and that this guides the healthcare provided. But unfortunately, this not always is the case, of course. But you as a patient, or as a parent in this case, can definitely also do something to improve that. One of the first things you can do is use your patient empowerment, and definitely the patient charity like CDH UK can very much help you with this empowerment by the information, guidance, and support they provide. And actually they can help you to know what to ask, or what to expect, or what to look for. And they can play an active role in receiving care that definitely meets your needs. But also another point that is very important is using your patient's voice. So if you're asked to evaluate or provide feedback on care, please do so, because that makes the care provided better. But also if you're not asked to provide feedback, but you're not happy, or you are happy, it's always good to raise your voice and tell that in order to improve healthcare. And the other option, and that's where the rest of my presentation also will be on, is you can participate in research that represents the patient needs. Well, how can you do that? You can participate in qualitative research, and qualitative research is actually the type of research in which a person's world and perception is very important. So it's less on collecting a lot of data and numbers on certain outcomes, but it's more a way of collecting information from the experiences of the patient and his or her family. And often this information is collected by listening to your story and to how you have experienced a certain event. This can be done in a group discussion or like in an individual interview. Well, it's also therefore that I'm very, very grateful that CDH decided to fund one of my projects, in which I will be looking at the patient-parent perspective. And I will like to clarify a little bit how this project can help clinical care. What we are going to do is actually develop two instruments in which we can evaluate but also support parents the care, and that the way that meets the parents' needs. The first instrument that will be developed is the patient-reported experience measure, which is actually measuring the quality of clinical care as perceived by parents and patients. And it will therefore evaluate the provided care on whether it meets the needs of the patient and their families. And it is therefore a mean to stimulate and improve care provision in a way that it becomes patient-centered. The other instrument is a patient-reported outcome measure. And this is an instrument focusing on the outcomes, but outcomes as important and relevant to the parents and the patients. So it will be an instrument relevant to patients and their parents, but it can be used for future parents in when facing a diagnosis of CDH in their unborn child to prepare themselves for the counseling. And it can be used during counseling by the patient itself, by the professional, and it can help you to ask the right questions and help to gain the best information possible. Well, how do we develop these instruments? Well, the patient-reported experience measure, measuring quality of care as perceived by patients, as I said before. And it is, both instruments are going to be developed in a stepwise process. And for this instrument, we first will determine the topics that are relevant to patients, but we will do that based on the dimensions of patient-centeredness, but also with input from relevant stakeholders. So at that point, we will have a list of dimensions, topics that are important, and then we will move over to parents that have been in a situation of prenatal diagnosis of CDH, and we will ask them to define what exactly these topics for this specific situation means. So then the end product will be an instrument. In this way, this will be a questionnaire that will help to evaluate care and that it is provided as much as possible in line with the patient's needs. Well, the last instrument, or the second instrument, is the patient-reported outcome measure. So this is not on experiences of parents, but it's on outcomes. Also, this is a stepwise process, and first, the outcomes of importance are determined by interviews with the relevant stakeholders. So you can think about parents, the professional patient representatives that will take part in this. And then if we have a list of outcomes, there will be a consensus meeting in which we determine which are the most important outcomes. Then they will be translated into a questionnaire, an instrument, and that is validated and tested. And the instrument will then be used for guiding, supporting, and measuring the care provision as well as important to patients. Well, it was a short presentation and maybe a lot of information, but I hope I've managed to clarify a little bit on the research that I'm working on. And if not, please feel free to ask questions or join me for the breakout session in the afternoon. Thank you.